I'm Joe Augustinelli, Social Media Manager at Greenway Health, and this is Putting Possibility into Practice, the podcast from Greenway Health. And today I am joined by Jim Livingston, the COO of McEwen and Associates, along with Dr. Jeff Livingston, the CEO and an obstetrician gynecologist with MacArthur OBGYN, located just outside the Dallas, Texas area. As I mentioned, Jim Livingston is the Chief Operating Officer of McEwen and Associates. They are a licensed management service organization provider of Intergy practice management. And Jim previously served as the Chief Financial Officer for the Dallas Mavericks of the National Basketball Association. So I welcome Jim and Dr. Jeff onto our show. And first of all, let's talk a little bit about the history of McEwen and Associates, where you're located and who you serve and what exactly you guys do.
Well, first of all, I want to thank you for the opportunity to be here, Joe. And we have used Greenway for the last 12 years. We love the Greenway Intergy system. And we've been committed to bringing technology. And really, I think I always cast it like this. We want to be first. And Greenway, the Intergy system, helps us to be first. It's got good technology. We can, whenever the latest release comes out, we study it and then we incorporate those best practices in our business. McEwen & Associates, I joined in 2006. Dr. Livingston had been in practice for a couple of years, and there were still 3 doctors there. My partner and I, Mike and Jeff and I, partners, when we started, we had 2 employees. We now have 38 employees. We provide services for close to 40-something practices and well over 100 doctors. And we also host practices in the cloud for businesses, practices as far away as Duluth, Minnesota, and McAllen, Texas. So it's a big area. The billing that we do provide is really mostly in Texas, and that's the central part of our business. One other thing I would like to add in terms of the McEwen & Associates and what we actually bring to the table from a management standpoint is I think we bring solid business practices. And one of the things that we look at in each business is what is the key business driver of that business. And in the case of OB-GYNs, it's referring providers and labor and delivery. We want all the doctors, that the labor and delivery nurses love every doctor. We take them pizza at midnight on New Year's Eve. We do all kinds of little things that we want to do that. And I think from the standpoint of reaching out to referring providers, we refer to their staff. We take them, again, big cookies and whatever it is on special occasions to make sure they know who we are and keep that brand awareness aware. That's a solid business practice for any practice. And I think the other thing for us is that known in Greenway and the Intergy system, the technology associated with that is, when we started it was pretty basic and it's just grown and grown. And I think we as a business put ourselves in a position to be able to grow with it and learn from it and to take it and use it to advantage in our business. And I think that's really important for any business.
And I have to ask this as a sports fan myself, but how does, Chief Financial Officer of the Dallas Mavericks, talk about your time with the NBA and how does one make that jump from the NBA or professional sports into healthcare?
Well, actually, it was very easy. The NBA really is probably maybe if it's not the best marketing business in the world, it's pretty close. And David Stern was just maybe the best commissioner in professional sports, certainly the best one I know. And so from a marketing standpoint, it was pretty easy because you're looking at reaching people, engaging people, because when you look at what you want to do, you're marketing to actually bring season ticket holders in. Well, the same thing was with patients, because what you want to do is every time you see a patient, every time you call, every time someone, make sure that patient has a good experience. Same way with ticket holders, same way with advertisers. It's all about the experience. When you come to a game, it's all about the experience. When you walk into this office, it's all about patient experience. We want it to be a good one. If you go back and you came to our comm center and you saw, we asked the comm center agents to smile when they're talking to patients, because smiling is a key. You smile when you walk in and you see our people smiling, and the first thing, it's a key to business. And so all of these things I learned really in working with the Mavericks, and it's in their marketing department. I think what we then centered is the same thing with season ticket holders. We center here with patient care. So everything is all about excellence and patient care.
And now, since starting with MacArthur OBGYN and McEwen Associates, how have you seen patient engagement and patient care evolve with your Greenway solutions that you presently use?
Well, Dr. Livingston will mention about the use of the patient portal. The patient portal, the analysis that we ran, we looked in 2017 how many secure messages, for example. We had roughly 1,400 people. We sent out 11,000 messages. This year, the same period, the first 4 months of this year, we sent out 33,000 messages. We have 3,500 people on the patient portal. So that engagement, it's a constant. Patients know they can, in effect, it's almost like an email, although it's HIPAA compliant. Send it to you. You answer that really fast, and you get the answer back. It also allows you to document easier what you've done. That part of patient engagement. Second thing is everything is moved to electronics, and so we just don't like paper here. If we have to use paper, we will, and there are certain things that we have to do. We don't really like faxes, but hospitals still fax stuff to you, and it's just a pain when actually you could log in and get that same information, and it'd be a lot easier to. But anyway, it's still a wasteful system, but we're getting there. But I think technology with the Intergy system, we have streamlined our business, and whenever we get a new process coming in, we analyze it and we figure out how do we change the process to use it in a best practice way.
And finally, how key has Intergy been in the growth of the practice? I know when you guys first started, it was 3 providers, and you're much larger than that now. So as you've added providers, as you have added services, and now as you see so many patients a day, how has Intergy helped with the growth of not only services but serving the community?
Well, first of all, I think the brand awareness of that is that we are a high-tech business. I think that is really important, I think, to a big sector of the community where you can come in and you can know, hey, we're getting the best here. But in using it, we're able to see many, many more patients because we're able to put as much as we can on the medical assistants to gain that clinical information and try to limit the time with the doctor. So the doctor documents, but a lot of that is technology driven, where it's point and clicks, and we've added key phrases and words in there that the doctor can actually kick on. So it's not as much typing as you might think. And I think the other thing is that we're looking forward to AI and the improvements of it. I think voice recognition is going to really help us a lot. So I think we're just sitting in this position to actually, we expect great things, actually.
And that was Jim Livingston, the Chief Operating Officer of McEwen Associates. I thank Jim for his time, and now we'll bring in Dr. Jeff Livingston, who is an obstetrician and gynecologist and CEO of MacArthur OBGYN. Doctor, just discuss a little bit about MacArthur OBGYN, its services, and how big it is.
Great. Thanks so much for having me on. I've been a listener of your podcast for a long time, and in fact, I was listening last night. So to get a call and to be invited as a guest is a huge honor. So MacArthur OB-GYN, we really expanded into now becoming MacArthur Medical Center. So we're a large multi-specialty group in the Irving, Texas, but also serving Las Colinas area and the Hearst, Euless, and Bedford market. We have 3 locations. We're now up to 18 OB-GYNs and 27 total providers, OB-GYNs, pediatrics, urogynecology, and midwifery, and expanding every single day. We've been a customer of Greenway since 2006 when we incorporated Intergy and electronic medical records into our practice. We really try to be a cutting-edge practice, not just in the way We use electronic health records, but also in the way we use technology, social media, patient outreach, internet search optimization, and even the way we approach surgery and medical device and medications. And so we try to be an extremely proactive practice, adapting to change, and making sure that we provide the best care that we have in the best possible way.
Over now the past 12 years, how have you seen Intergy change to help you guys stay on the cutting edge when it comes to technology?
As technology evolved, it really became crucial to switch over to electronic health records. And as many of your listeners know, that is a very challenging and difficult process to go from paper to electronic records for the first time. And we made it through. It had its challenges, but I think everybody in the practice would agree that was the right move at the right time. Really now, we're sort of in the next phase. Is we've adopted EHR into our practice. I don't think any of us could see us functioning without it. Now the struggle is really one of the topics that always comes up, which is interoperability. We have 3 hospitals, all 3 of which use different electronic health records. We have Greenway Intergy in our office, and we've got the same interoperability problems that all practices deal with. Within the office, though, we've used the tools that Greenway provides to really expand our ability to take care of patients. So several years ago, we adopted the patient portal, and that's been an amazing efficiency improvement for our patients. We now have thousands of patients that use our portal. They message back and forth with our medical assistants. They can schedule their appointments online. They can reschedule online. We can send lab results. We can send lab explanations, answer basic questions. We can answer a question through the HIPAA-compliant secure messaging system and not use the telephone. That's better for everybody.
Transition from paper to electronic for practices who may be just going through that, or practices who are considering, going through that. Just talk about that transition.
So I always tell people that electronic health records, it's sort of like the way people talk about the brain. So we have a brain in our head, and neurologists say we use about 10% of it. Well, with electronic medical records, people tend to purchase it, they get trained, and then the trainers leave, and then they use what they know. And in reality, they're using about 10% of the functionality of the EHR. Once you make it through that transition phase, it's really important in your organization to put someone in place who can continue to learn and then can continue to bring innovation to the practice. The EHR systems are capable of doing so much more than what you learn in your initial rollout. But you have to have infrastructure. A huge enterprise hospital system, for example, they're going to have a CIO. The CIO can do that. If you're an independent practice, in our case, we're pretty big at 26, but there may be a 2-doctor, a 3-doctor, a 4-doctor practice. They're not going to have a CIO. So it's important to identify someone in the organization who can take on that role. Otherwise, for the rest of time, you will only use your system in that 10% that you learned initially. And so we have not just one, but several people that take team lead on this. And we constantly are looking for ways to improve and looking for new functionality that we can add to our system.
And something else you mentioned, the use of the patient portal and just how it has enhanced communications between providers and patients. Now in 2018, have you seen a change in the healthcare consumer in a digital world where it really is accessibility and ease of use for something like that, where they can get a hold of a doctor right away?
It's really not a question anymore in my mind of whether a practice can or should have some sort of online access. It's really a must. There's a segment of the market that's not interested in that and never is going to be. But the large part of the market, it's now expected. And so for a patient to go to a practice that doesn't have that functionality, that may be a reason a patient doesn't choose your practice or leaves your practice. It's something they require and they need. I think the challenge is we're back to the interoperability problem. I was looking at all of my logins and passwords of everything I have in my life, and I have over 300 logins and passwords. One of the things I hear from patients is, oh yeah, I love your patient portal, but I can't remember my password. Just the other day, I went to a doctor and I had to create an account, and I was excited to do so. It turns out 3 years ago, though, I created an account. I don't remember which email or login or password. So I think what needs to happen over the next several years is simplification. Patients shouldn't have to remember a different login, a different password for every hospital, for every doctor, for every place they're getting health care. We really need to make a way for the patient to be the center, for them to hold the information, and that information to be pushed back out to the various areas where they seek care.
And something else you mentioned, talking about community outreach. I saw, of course, last year, both in Florida where we're based and here in Texas, and specifically down in the Houston area, both areas were hit hard by hurricanes, but evacuees from Houston made their way up towards your guys' office and under your care. Just talk about that process of accepting those patients in a time of need.
When Hurricane Harvey hit, probably other listeners on this remember seeing it, but there was a post on Facebook that went around, which was elderly people, and they were in their wheelchairs, and the wheelchairs were being covered up with water, and there was just really no way to get them out, and it was just a devastating picture to look at. And I was at home. It was Sunday night. I was laying in my bed, and I looked at that, and I just had a terrible feeling in my stomach. But it occurred to me, what are the pregnant people going to do? And there was lots of talk about other people, but I hadn't heard anything on the news about pregnancy. And if you think of pregnancy, that's not something you can delay. If you're due tomorrow, you're due tomorrow, whether can be in Houston or not. And so quickly I just typed out that if there were any pregnant patients displaced from the hurricane, they had a home here. We would see them, call us, we would take them in, and we would make sure they got their pregnancy cared for until they could either go home or until they were able to deliver. And then I went to sleep. Then I woke up the next morning and I realized, what have I done? Because the post had kind of gone viral, and there were thousands of clicks and shares and likes and comments. And I quickly thought, I probably should tell the people that are going to answer the phone what I did, and I probably ought to tell the hospitals that this might happen. So I made some quick phone calls, and everybody was on board to help. Not one person pushed back. All 3 of our hospitals were excited to get involved, and our call center was ready to take those calls. And we had some people that ended up coming in, and it was a wonderful experience for us and for them. And I think as physicians and the staff of MacArthur, it was really an opportunity to give back.
And when we discussed disasters and electronic health records, how hard was it to get information on these patients you were now seeing after they were evacuated in regards to getting their health records?
Years ago when Katrina hit, we had people that came in for that too. And, at that time the hospitals there was zero access. So you really couldn't get access at all. Now with Harvey, more things were electronic. So some patients did have access through their mobile device or through their phone, but it was still challenging to get it. And we were able to take care. There was nobody we weren't able to take care of because we couldn't get records, but there were records that we couldn't obtain.
And thank you, Dr. Livingston, for your time today. And I thank Jim, who was with us earlier, and Dr. Livingston, who you just heard from on today's episode of Putting Possibility into Practice. I invite you to follow MacArthur OBGYN on Twitter. Their Twitter handle at MACOBGYN. You can also find them on Facebook at MACOBGYN. That's facebook.com, MACOBGYN. You can go ahead and like their Facebook page. Once again, I thank you for listening to this episode of Putting Possibility into Practice, and thank my guests, Jim Livingston and Dr. Jeff Livingston, for discussing all the great things that MacArthur OBGYN and McEwen and Associates are doing in the Texas community. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and for more information on Greenway Health's product solutions for your practices, I invite you to visit www.greenwayhealth.com. Thanks for listening, and I invite you to subscribe to our podcast, Putting Possibility into Practice, on SoundCloud, and we're also available on the iTunes Store or on Google Play Music.